welcome to the Body Shop Physical Therapy. My name is Catherine Price, and I'm a physical therapist. Today, I'm going to go over the arthrokinematic restoration technique to help alleviate or diminish chronic or acute neck pain. And this can be neck pain usually from either looking down for long periods, such as if you're working on doing a puzzle or knitting, or working at a computer, or just spending a lot of time looking down. Sometimes you can develop neck pain that's on the back side of the neck, and this is more pain related in the upper portion, back side of the neck, and can even cause jaw pain and headaches. So this is going to be tension related neck pain and headaches. And the arthrokinematic restoration technique is going to be a series of release, stretch, and strengthen. And the order that I do this in is important in helping to alleviate symptoms. You can get some relief with these exercises separately, but I have found over the years that it is effective to do this combination in order to restore the joint positioning and mobility in order to help alleviate pain and hopefully alleviate some problems that can come over time and end up developing arthritis in the neck. So this also is beneficial if you've got that forward head posture. So we are going to work on restoring the alignment and joint mobility in the neck. Please consult your physical therapist or your medical doctor for the appropriateness of exercises for you. I am going to go through this series of 3 exercises, and it's going to be a release exercise, a stretch, and then a strengthen. And before I begin, I'm going to speak a word of life from Proverbs 17:22. A joyful heart is good medicine, but a crushed spirit dries up the bones. So the first thing I'm going to do is use 2 lacrosse balls. These are going to be connected. You can put 2 tennis balls in a sock, and that will be just fine. And you want to start with a softer surface and work to a harder surface. So I'm going to lie on my mat. I want to take these 2 balls and place them right between my shoulder blades. Now, if you've had neck pain for a while and you've never addressed this area, it's usually really painful, and so just applying pressure there to start with may be where you start. And you can even do this against a wall to start with if it is too uncomfortable to put pressure with body weight. So what I'm going to do is place those lacrosse balls right between my shoulder blades, and I'm going to lie on the floor on my mat. Now, after I've got those placed there, I'm going to then just let my head rest onto the floor. And then if I put my hands behind my head to support my head and neck, I'm then also going to feel a change. Now, if you've not had pressure here and there's a lot of tension, you may begin to feel some of the pain radiate up into the neck, into the side of the head. And these are going to be areas of trigger points. So then you can also take your hands and just bring them down to the floor, and you're going to bring them up overhead, and then what I call snow angels. So you can make snow angels with your arms, and that's just going to change the muscle as you're going through this range of motion. Then if you can, you want to support your head and neck, and then you want to roll between the shoulder blades or go an inch down and find another area, and then relax down and just allow your body to rest on that area. Again, you may find that this is really difficult to do in the beginning. And what I also like to do is, if it is difficult to use your body weight to move along, you can use a roller to make this a little bit easier. So I'm going to place those balls back between my shoulder blades, rest my head on the floor, and then I'm going to support my the back of my hips. So I don't want I do not want to have any back pain in this. I want to be supported. So I'm going to support the very part of my back in the back of the hip, and I'm going to just use my legs, and I'm going to keep my chin tucked to my chest and my head supported with my hands, and I'm just going to gently roll an inch up and an inch down, and I'm going to roll slowly, just addressing that tension there. And then if I find an area that seems really tender, I'll just rest there. And then again, you can use your arms, and you can go into flexion and then out into those snow angels, and then just resting here. And you want to spend about 5 to 10 minutes mobilizing this tissue. So once you've progressed to where you do not need the roller, you can then lift your bottom and use your body weight, and that's going to intensify the pressure in that area. And this gets better over time, and it gets to be easier, and you'll have less and less referral of that pain as the trigger points release in that region. So you want to spend about 5 to 10 minutes doing this. After I do this, I am then going to progress to my stretch. So I'm going to release the muscle between my shoulder blade, and then I am going to stretch the front of my neck. So this is going to stretch some of the scalene muscles on the front side of the neck. And I will you can use the edge of a bed. So this is going to be a table that I am just going to take the back of my head, and I'm just going to rest it on the edge. So I want to hook the base of my head right on the edge and let my head lean back. And I just want to hold this for 90 seconds. So I like to spend 2 minutes at least to shorten the back side of the neck and stretch the front. And so you should feel a little bit of traction in the neck when you do this, and it shouldn't be painful. So if you're having pain in this position, you do not want to hang out here. If you have stenosis, central canal stenosis in the neck, this is not an ideal position, and you want to be assessed to make sure that you are doing appropriate exercises. So you're just going to let the weight of the head hang as you can. You can bring your head back a little bit more, but you want to keep the head supported when you do this. A good place to do this is on the edge of the bed, because you can have a nice soft cushion behind the head. You don't want to have a hard surface pressing on the base of the head there. And just relax here. And if it feels good, you can hang out here longer, but at least 2 minutes in order to shorten the back of the neck, but also to stretch the front. So this is the second part of the series of release, stretch, and strengthen. The first part is the release, the second is the stretch, and then the third part is going to be the strengthening portion. So we're going to strengthen the deep neck flexors, and that's going to help with that forward head positioning and help to stabilize and hold the head and reposition those vertebrae. So just hanging out here a little bit longer. And again, you can stay here longer if it feels good to you. All right, so the first part, just to recap, you want to roll between the shoulder blades for about 5 to 10 minutes. You then want to stretch the front of the neck by allowing the head to be supported and go into extension and just hold here. And then I'm going to bring I want to bring my chin to my chest when I'm transitioning to support the head. So I'm going to bring my chin to my chest, and then I'm going to roll right onto my stomach. Now you can use a towel roll for this strengthening portion. I am just going to rest my forehead right here on the table. My arms are just going to be relaxed. I'm going to keep my chest on the table. I'm going to draw my chin into my chest, and I'm going to hold this position for 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. I should feel the front of the neck working and the lengthening of the back of the neck, and I want to keep my chin down. 4, 5, 6, 7, 8, 9, 10. Relax. Drawing my chin in and holding. 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And lifting. 2, 3, 4, 5, 6, 7, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. 2 more. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Relax. And last 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and relax. So that completes the series of release, stretch, and strengthen for arthrokinematic restoration, and this should help with any acute or chronic neck pain and help to keep the joints in the spine of the neck healthy over time. Have a blessed day, and thank you.